thousands of workers go without pay, and now President Trump is suggesting some federal workers shouldn't get back pay whenever the government does open. Joining me now is Democratic Congressman Stephen Horsford of Nevada. He is a member of the House Ways and Means Committee. Thank you so much for being here. Just first to what the president said yesterday, that some federal workers he may suggest will not get back pay and others will. Can the president decide this on his own outright?
Well, thank you, Sarah, for having me on. And no, the president cannot decide this unilaterally. There's actually federal law that indicates that federal furloughed workers will be paid when the government is reopened. And I've introduced legislation to make sure that the workers get paid everything plus the fees and fines that they may incur during a government shutdown. And as co-chair of the Labor Caucus, we will continue to push to protect federal workers so that they are made whole. This is a government shutdown that is a result of Donald Trump and Congressional Republicans' inability to govern, to pass their own budget. They don't have the votes to pass their own budget, and House Democrats are demanding that they come to the table to save health care, to lower costs, and to cancel the cuts.
You are speaking to the fact that Republicans could break the filibuster and go this on their own without the 7 Democrats that they need. And Democrats have been holding off voting on this Republican spending measure because they want to guarantee that health care subsidies will be funded. That is not currently in the bill. And guess who agrees with you? Marjorie Taylor Greene. She's lashing out at Republicans over health care, siding with Democrats, saying this: I'm absolutely disgusted that health insurance premiums will double if the tax credits expire this year. And she goes on to say she's frustrated with and thinks it's a scam, insurance and all that. But then she says not a single Republican in leadership talked to us about this. So it seems to be saying what Democrats are saying. Do you think that her voice will help push this agenda forward and help end the shutdown?
Well, I think the voice that matters the most is the people of America and their voice, demanding that Congress act to avoid the premium increases to their health insurance. In Nevada, a family of 4 with an average income of about $64,000 would see their health premiums increase 193%. That's $2,500. Outside of paying the rent or the mortgage, the cost of health care is the biggest expense that families have. And the American people are speaking very clearly with one voice. Congress, do your job and save health care. That's what House Democrats are fighting for. And I'm glad to see that one of my Republican colleagues seems to understand that these cost increases with the premium tax credits expiring are untenable and must be addressed now, not later.
I want to ask you about a couple of your Democratic colleagues, one of whom was in Portland saying, look, in her mind, because of this warlike mentality from the president saying that it's a war zone in Portland, to ask the demonstrators not to rally, not to protest outside of ICE facilities for now, to take it somewhere else. What do you make of that? Is that a good message?
Well, unfortunately, we have a president and an administration that's more focused on wanting to occupy U.S. cities than they are wanting to lead them. And I have the utmost confidence in the governors of these states and local law enforcement to keep communities safe. And if the president was serious about making sure that law enforcement and those governors have the resources, he would tell Speaker Johnson to reopen Congress for us to pass the budget and to restore the cuts to health care, as well as the COPS program and community violence intervention that they also defunded as part of their partisan budget. We are about protecting the American people, and that means both their health care and their public safety.
Look, there's a lot of been talked about messaging from Democrats, and we heard from a Democratic representative who's running for governor in California, Katie Porter. And I want to let you listen to what she said after she was asked whether or not what she was going to do about the 40% of people in California who voted for Trump, and how she would sort of encourage them to vote for her. Here's how she responded during an interview with CBS.
And what I'm saying to you is that,
well, to those voters, okay, so you...
I don't want to keep doing this. I'm going to call it. Okay. Thank you.
You're not going to do the interview with us?
Nope, not like this. I'm not. Not with 7 follow-ups to every single question you ask.
Every other candidate has answered.
I don't care.
Follow-ups.
I don't care.
She was being asked whether or not she needed those votes and what she would do to entice them, and said she didn't need them. What do you make of that? Is that a good message?
Well, what I'm focused on in Nevada is actually listening and learning from the constituents that I represent. My district covers 50,000 square miles from rural Nevada to the urban communities of Las Vegas and North Las Vegas. And what my constituents tell me is that today their health premiums are about to double if Congress doesn't do its job to act. They are worried about the cost of housing and childcare and groceries and energy costs. And that is why House Democrats have said, cancel the cuts, lower the cost on the American people, and let's save health care by making sure that we extend these premium tax credits so that insurance doesn't double or triple on behalf of the American people. That's what Nevadans and people all across the country are concerned about, and that's what House Democrats, led by Hakeem Jeffries, are fighting for and standing up for here in Congress. It's time for Speaker Johnson to have the respect for the American people and reopen Congress so that we can do our job.
All right, Congressman Steve Horsford of Nevada, thank you so much for coming on this morning. Appreciate it.